Hello friends, now let us continue our discussion in ophthalmology with myopia, right? So here, what is myopia? Myopia is also called as, I think the before size is quite better. Okay, it is also called as short-sightedness, right? Here there is good vision for short object, less near objects when compared to farther objects. But here, what is short-sightedness and myopia? What are the causes? Etiological classification. The etiological classification of myopia is similar to hypermetropia, where there is axial myopia, where the anterior-posterior length, if you see, this is the eyeball, the anterior-posterior length is increased. In axial myopia, there is increased anterior-posterior diameter. That is the important feature of axial myopia, where there is increased anterior-posterior diameter. And the second type is curvaceous myopia. So in curvaceous myopia, you can generally see the increased curvature of cornea. So here, cornea and lens curvature is increased, that is increased curvature of cornea and lens. And the third major type is positional myopia. So in positional myopia, there is misplacement of anterior placement, basically anterior placement of lens. In hypermetropia, there is posterior placement of lens. So here in positional myopia, there is anterior placement of lens. The lens is placed a little anterior when compared to normal one. And the fourth type includes index myopia. So what does index myopia include? Index myopia includes increase in refractive index. So refractive index of the lens increases in index myopia, right? In index myopia, there is increase in refractive index of lens. And there may be also myopia due to accommodation. Due to accommodation, there may be myopia which is seen, right? So myopia may be also due to accommodation. So all these are the different etiological features of myopia. One is axial myopia, curvaceous myopia, positional myopia, index myopia, and the myopia due to accommodation. Now what are the gradings of myopia? Just like hypermetropia, even here there is grading for myopia. So the grading for myopia, it may be low, moderate, severe. If you see low, it is less than or equal to 3 diopters. If it is moderate, here it's minus 3 diopters. If you see hypermetropia, it is plus 3, here minus 3. If it's moderate, minus 3 to minus 6 diopters. If it is severe, it is greater than or equal to minus 6 diopters. So all these are the grading for myopia, which is of 3 types: low, moderate and severe type of reading. So what are the clinical varieties of myopia or classification of myopia? So that we have to deal with each and every classification of myopias. So the first classification of myopia, in that the first variety includes congenital myopia, which is the myopia which has been occurred since birth and then the other one is simple or developmental myopia, and the third one is pathological or degenerative myopia, and the fourth one is acquired myopia. Right, so the myopia is basically divided into four major classifications. One is congenital myopia, next simple or developmental myopia, pathological myopia, or degenerative myopia, or acquired myopia. Again, in acquired myopia, it can be post traumatic, that is, it may occur after trauma, so it may be called as post traumatic, or post keratitic, that is some keratitis after the inflammation of cornea. That may lead to myopia, which is post keratitic, or it may be drug induced. Most common cause, it may be drug induced myopia, or it may be pseudo myopia, it may be space myopia, or it may be night myopia, which is generally occurs in night. So saying all these names doesn't generally make any sense, I know, but as you go through it, it becomes really easy. Or consecutive myopia. All these are the different types of classification of myopia, which is congenital or simple or developmental myopia, pathological or degenerative myopia, or acquired myopia. In acquired, it is of different types. So coming to the first type of myopia, which is congenital myopia. As the name says, it is since birth. Right, it is present since birth, and this is generally seen between 2 to 3 years of age. It is diagnosed between 2 to 3 years of age. So what are those which are present in congenital myopia? One is anisometropia. What does anisometropia mean? In anisometropia, in both the eyes, the error is different, or there may be error in only one eye, error in one eye, or different error in two eyes, that is anisometropia. The second type is high degree of error. Well, what high degree of error is seen? It is around 8 to 10 diopters, right? 8 to 10 diopters of error is usually seen. The third major feature of congenital myopia includes convergent squint. This is because in order to see far objects, continuous accommodation results in this convergent squint. Reason why is it developed? To clearly see far points. This may develop convergent squint. And the fourth type is association. Fourth feature is associations with cataract or microphthalmos, small eyes, or there may be association with aniridia or megalocornea, that is bigger cornea. Okay, all these associations may be seen. And what is it surely done? RX is early correction is to be done. Right? All these are the major features of congenital myopia. So here At first we have learned about myopia, etiological features, grading, classification and congenital myopia. Now coming to the other type of myopia, which is most common in many students or in many people, is simple myopia. So this simple myopia is the most commonest variety, and this is generally a physiological error, and this is seen in 20 to 40% of the population, and this is usually may be seen at 8 to 12 years of age. Then it is called as school myopia. If it is seen between 8 to 12 years, then it is called as school myopia. So what are the etiological features? So this is seen in school, or if it is seen in children between 8 to 12 years of age, then it is called as school myopia. Etiological factors. The major etiological factors, it is same as normal myopia with little more additional factors. One is axial type, which we have already discussed, that in axial type there is increased anterior-posterior diameter of the eyeball. Next, curvatural type. Here there is increased curvature of lens, and the cornea occurs. Next, role of diet. In early childhood may also result in is also seen, and it is also reported, that is eating some deficiency of vitamin A or some deficiency of carotenoids, antioxidants results in this myopia. A role of genetics is also being reported. So so here, if the parents have myopic, if both parents are myopic, then the children have 20% of chances of being more myopic, right? So 20% increased risk is seen for genetic cases, and if only one parent is myopic, then 10% increased risk. If parents are myopic, if only one parent is myopic, then there is 10% of risk, and if no parent is myopic, then the risk is around 5%. So theory of excessive near work, that is, if a person plays lots of games, right, in cell phone, which is really very common nowadays, that may also lead to simple myopia in children. So this theory of excessive near work is also been proposed, but there is not much importance there is not much importance seen for this theory. So coming to clinical features, if you see first symptoms, so the symptoms include, first, poor vision, that too for distance, that is defective vision for far objects. And the second one symptom is asthenopic symptoms. What the asthenopic symptoms like headache, tiredness may be seen, and there may be half shutting of eyes. He tries to shut eyes so that to gain better accommodation, a child may shut his eyes, and the signs include prominent eyeballs because of increased anteroposterior diameter. Prominent eyeballs may be seen because of increased anteroposterior diameter. and here anterior chamber is deeper. This is because of increased anteroposterior diameter. The anterior chamber becomes deeper because of increased diameter, and pupils are large, and fundus is normal. So here there are differences between myopia and hypermetropia is clearly seen. So in hypermetropia you see anterior chamber becomes shallower, pupils are small, and fundus is also normal there. It has some changes too. Now coming to diagnosis. Diagnosis is by refraction. Some refractive tests, by doing some refractive tests we can find the diagnosis, whether it is simple myopia or not. So this ends about the topic of simple myopia right now. So if you see, the etiological factors are same as myopia, normal myopia, which may be axial, curvational, but the major difference is there is role of diet and genetics was seen, and theory of excessive near work was also postulated. If you see symptoms is same, it may be poor vision, that too for distance because it is myopia, and there is asthenopic symptoms may be seen, and half shutting of eyes may be seen. If you come to signs, the eyeball becomes prominent, anterior chamber becomes deeper, pupil is large, and diagnosis is through refractive test. Now coming to one more type of myopia, which is pathological myopia. Now this, as we have already seen, there are mainly 4 types of myopia. One includes congenital, next simple, next pathological myopia. This pathological myopia is also called as degenerative myopia, or it is also called as progressive myopia. It may be called as degenerative or progressive or pathological myopia, right? So this myopia is a refractive error, and it is progressive and starts at 5 to 10 years of age 1, and it is progressive disorder and starts at 5 to 10 years of age, and by adults, when it reaches to adults, as it is progressive, once it reaches adults there may be high myopia, and this high myopia can be as high as greater than or equal to 6 diopters. Coming to the etiological factors, one major etiological factor here is basically hereditary. Role of hereditary, it is generally different when compared to other types of myopia because it is there is some pathology underlying it. So one etiological factor is role of hereditary. Now the role of hereditary or genetic factors has been confirmed. The major factors are, one is it may be familial, that is it may run in families, or it is common in women when compared to men, and this is associated with autosomal dominant condition. As you saw, if it's genetics, we see autosomal dominant or autosomal recessive condition. Here it is associated with autosomal dominant condition, and it is linked to genes. If you see 18p, 11.31, 12q, 21.23. These two are the genes which are linked to this pathological myopia, and it is common in some races. Basically it is common in Chinese, Japanese, Arabs, and it is uncommon in Negroes, right? So all these are the hereditary factors which is related to pathological myopia. So hereditary or genetic factor is important determinant for myopia development. So now coming to the second factor, which is role of general growth factors. There is some role of general growth factors, like these are minor when compared to hereditary. Hereditary is the major part, but this cannot be, what do we say, we can't leave it just like that just because it is plays a minor role. So this role of general growth factors are, what are these factors? It may be nutritional deficiency, or it may be some debilitating diseases like diabetes, hypertension, or any other debilitating diseases, right? Or it may be some endocrine disturbances like Cushing syndrome, etc. All these leads to increased growth of retina. This increased growth of retina results in stretching of sclera. Once there is increased growth of retina, even sclera has to be stretched. Stretching of sclera occurs. If there is sclera stretching, that is, if there is sclera because of retina increased length, even the sclera stretches. So because of stretching of sclera, there is increased axial length, that is anterior-posterior diameter, that is axial type of myopia, and then there is, because of stretching of sclera, there may be degeneration of choroid, because that choroid may not be stretched that well when compared to sclera. So there is degeneration of choroid, degeneration of retina, and degeneration of vitreous. All these may happen, right? So all this is a pathogenesis for role of general growth factors. There may be some deficiencies or diseases or disturbances which leads to increased growth of retina. If there is increased growth of retina, there is stretching of sclera, which leads to increase in axial length. There may be increase in this axial length, and then there may be degeneration of choroid, retina, or vitreous humor. Now, what are the major clinical features for this type of myopia, that is pathological myopia? The clinical features generally include: 1. Defective vision, as I have already discussed. There will be defective vision, that is inability to see far objects. Next, muscae volitans. In muscae volitans, if this is the eye, right, the person is seeing with this in this way. Just imagine that a person sees like this. So in his visual space, we can see black opacities, right? These are called as muscae volitans. Muscae volitans. These are black opacities in front of eye. These are called as muscae opacities. These are black opacities in front of eye. Now it may also manifest as night blindness, right? It may also manifest as night blindness. So what are the signs? signs include, the first one is has same as the simple myopia. There may be prominent eyeballs. Eyeballs may be so prominent here. So, or they may be prominent or maybe elongated. Right? And the cornea, because of elongation, the cornea will be large, and because of large pupils are large because of prominent eyeball. Because of large pupil and the cornea is large, anterior chamber will also be large, or it may be deeper, to say chamber is deeper, right? And if you see the fundus examination, so in fundus examination, this is the fundus of myopic fundus. So what do you see in this fundus? If you see one, you can see the optic disc, right? Okay, so you can see optic disc. This is the optic disc. So optic disc is generally here in myopia. It is large and it is pale. And this is a crescentic shape. See, this is myopic crescent. This thing is myopic crescent, right? Myopic crescent is C, right? So this is about optic disc. Sometimes you can see peripapillary crescent also, which encircles the disc. Sometimes peripapillary crescent is C. So this may encircle the disc. So right, so this is about optic disc, which is seen in fundus examination. And sometimes you can even see supertraction crescent. Supertraction crescent may also be seen. So all these are rarely seen, but we really, being undergraduate, we can't appreciate all this, but try to appreciate if it's possible. The other type of degenerative changes, we can also see some degenerative changes in choroid and retina. So what are the degenerative changes which can be seen? So one, at macula you can see chorioretinal atrophic patches, right? You can see chorioretinal atrophic patches. All these are the different patches. And you can also see Foster Fuchs spots. Foster Fuchs spots. These reddish color things are Foster Fuchs spots. They are basically, if you see, you have already seen it. This is a Foster Fuchs spot. This is the biggest one. This is the Foster Fuchs spot. Right, so this Foster Fuchs spot, it is a dark red and circular patch. And why is it seen? The reason for it is subretinal neovascularization. Subretinal neovascularization may result in such type of circular patch which is called as Foster-Fuchs spots. Right, so this is the Foster-Fuchs spot. You can see dark red circular patch which is seen. And the third type of degenerative change is cystoid degeneration. This is seen at periphery. So at the periphery you can see cystoid degeneration. And next, the fourth type is lattice degeneration. Or snail track lesions. So these lattice degeneration or snail track lesions, they may be present with retinal holes or tears. Right, these may also be present. And the fifth is total retinal atrophy. There may not be any retina which may be seen. This is a condition which is seen in pathogenic myopia. Now coming to the third, if you see here in fundus examination, first you look about the optic disc. So this is your first thing which you see in fundus examination. Next you see whether there is degenerative changes or not. Apart from optic disc, you see the macula, and then you see whether the Foster spots or some other degeneration changes are seen or not. And the third one which you will see here is posterior staphyloma. Right, posterior staphyloma. Posterior staphyloma is seen due to ectasia of sclera. Why is that this happen is because of ectasia of sclera, that is degeneration of sclera. As you have seen, there is stretching of sclera. Instead of degeneration, we can use the word stretching of sclera. So this stretching of sclera may lead to posterior staphyloma, which is seen in pathological myopia. There may be degenerative changes in vitreous. So what are those degenerative changes in vitreous? So the first degenerative changes in vitreous include the degenerative changes of vitreous which you can see include liquefaction, vitreous opacity may be seen, and you can also see posterior vitreous detachment can be seen. So all these are seen in fundus examination, right? So now coming to the final examination, you will also see visual fields, right? Visual fields will also be seen, and you'll also see ERG, which is electroretinogram will be seen, right? So all these are the clinical features and the signs of myopia. So this is about my just a second, I'm sorry for inconvenience. myopia. So now coming to the complications of myopia. So if you see the complications, so now what is left here is complications of myopia and the treatment. So complications of myopia. So it's simple. The first complication is, as I have already said, there is retinal degeneration, right? So sometimes there may be retinal detachment also. That is removal of retina from, generally retina is attached in this way. This undergoes detached, that is it comes outside. So that is retinal detachment that may occur. Or there may be complicated cataracts. You know where the cataract occurs? Cataract occurs in lens. So in the lens there may be some complicated cataract which is occurring. And the third one may be vitreous hemorrhage. So where does this vitreous hemorrhage occurs? In the vitreous fluid, which is in the posterior. So all this vitreous fluid, there may be some blood accumulation or hemorrhage in this, which is a complication. Or fourth, there may be choroid hemorrhage, because choroid is the most vascular structure of the eye, so there may be choroid hemorrhage. Or fifth, there may be strabismus, fixus convergence, which you will learn later clearly. Or there may be primary angle glaucoma, which is due to increased intraocular pressure. Primary open angle glaucoma. So right, all these are the complications of myopia. Now coming to the treatment of myopia, if you see the treatment aspect, there may be optical treatment and surgical treatment, same as what we have learned in hypermetropia and aphakia. So if you see, optical, not optimal. So optical treatment, if you see optical treatment, one, correct myopia. That too through concave lenses, right? Concave lenses can be used in either spectacles or contact lenses, right? They may be used either in spectacles or contact lenses. They may be used in any way. And then the major advantage of contact lenses is cosmetic purpose here, but contact lenses are only justified, or they are only better used in high myopics. And for surgical treatment of myopia, so this is optical treatment. You can also do surgical treatment of myopia, which is very popular, that is LASIK. I would like to deal about the surgical treatment completely later, right, so that it becomes easier for explaining all the surgical treatment at the same time. Or there is important general measures which should be taken into account by the patients, which include balanced diet, taking high vitamin A supplements or vitamin A food and high carotenoid food, and early management of diseases, because these diseases are also an important cause in pathological myopia. So early management of diseases is necessary. And third is visual hygiene, that is, don't rub your eyes unless and until it's urgent, and take care of your eyes, because eyes are the most important organ in your body. And the fourth is avoid outdoor sports to decrease risk of trauma. But though this is not true, because outdoor sports are really good for our health, but I don't advise this because not generally necessary, because it's our age to play. Low vision aids may also be used, because if this is mostly used in advanced degenerative conditions. If the person cannot use spectacles or contact lenses, and even on using them there is no change, then we use this low aid vision, and we can take prophylaxis. This is done by genetic counseling. So this is the important chapter which we have dealt now, is about myopia. In myopia we have dealt about etiological factors and clinical features, signs, symptoms, complications and treatment. Thank you for your kind attention. And right now you can even if I have made any mistake, you can just write in the comments. Then